All right, you're 65 and you are eligible for Medicare, but even if you don't need the benefits because you already have insurance, do you know that you still have to enroll in Medicare? And there is a timeline for you to enroll. Why is that? Well, our Medicare and health insurance experts are here to explain all the things and much more. Catherine Sevier from AARP, Steve Edmonds from Alliance Insurance Services. They are taking your questions today. So make sure you get your questions to them. 336-379-5775. That is the number to text in your question. All right. So let's break down the timeline first. All right, so Catherine, let's go this. What is the timeline of enrolling for Medicare?
So each of us have to enroll in Medicare 3 months before, the month of, or the month after our 65th birthday. And you want to do that whether you're still working or not, because that is the time that Medicare says to us, we need to know about you and enroll you in the plan.
All right, so Steve, and we're going to say this a couple of times because we always get, kind of the same list of questions when we do this. People will say, but I don't need that coverage, so why do I have to enroll? And the short answer is because if you don't, you're going to get penalized. Let's talk about those penalties.
Yeah, so the thing is, even if you're still working, you can still go ahead and enroll in Part A because Part A is free. So it's like, why not take it? I mean, it's free. So go ahead and enroll in A. You can defer B until you do retire later on. But yeah, there's large penalties if you miss your enrollment windows there. Like on the Part B, you have a 10% penalty. On Part D, which is your prescription drug coverage, you have a 1% penalty per month for every month that you missed your enrollment. So when you add these penalties up, they can really skyrocket over time if you wait a long time. And guess what? The penalties never go away. So they're with you for life if you happen to fall into that situation. So it's important to understand that and to get enrolled.
Okay, and we kind of had like a graphic up that talked about the different kinds of Medicare, and so people sometimes often ask about those specific kinds of Medicare, so feel free to ask your question. Catherine, this is a question that we get very often when it comes like that. Well, why did the government make it that way?
Well, the government made it that way in 1965 when they enacted the Medicare Act, and they have a formula for all of that so that we all get the same thing starting at the same time. And that has been consistent from the beginning of time.
Okay, and because of that, that's just the way it is. So it is not going to change. If you don't
Nope.
enroll when you're 65, then you are going to be penalized and you're going to be paying for the rest of your life with all of that. All right, now let's talk about that intricate thing of the Part B. So there's like a little box that has to be checked. Like you're not actually taking Part B, but you actually have to check a box that says you're deferring Part B, because if you don't check any box, what happens?
So on the Part D, if you don't check the correct block and you don't have drug coverage, you're going to be penalized. So now, how can you have drug coverage? Well, if you're still working and you're still covered under your group employer plan through a company or through your work, then you will be considered to have credible drug coverage by the government, and you won't need to sign up for Part D. But if you don't, you do need Part D. And if you don't, like I say, the penalty is 1% per month for every month that you went without coverage from when you initially turned age 65 and was eligible. So the penalties can be a lot.
Okay, so we've got Part D as in dog and Part B as in boy, and you need to sign up for both of those and defer if you need to do that just in case. All right. Catherine, so many people are going on vacation. Does Medicare cover you when you are traveling?
Yes, it does. It does cover you when you're traveling in the United States. It does not cover you when you are traveling internationally, so you need to make a plan for any international travel.
Okay. All right. And so we always know that every single year things kind of change here and there. We are looking for some changes coming up this year. Steve, what are a few of those changes?
The biggest change is going to be in the Part D, which is the prescription drug coverage. And it's not only just a change, it's probably the biggest change that has ever come about in Medicare. I mean, it's going to be huge. And it's going to be a win-win for the consumer. Basically, the donut hole or the coverage gap is going to be going away completely. So all you're going to be left with is an initial coverage phase where you just pay your copayments. And then after your prescription drugs add up to $2,000 in a calendar year, you're going to be covered at 100% after that. And right now, just to put that in perspective, now it's $8,000 for drug coverage before you're covered at 100%. So that is going to be a huge win for the Medicare beneficiaries. A huge win.
Okay,
yes.
and that's going to come when you have Medicare re-enrollment, which is later on this fall.
Yes, and it actually will begin on January 1st of 2025. But yeah, it will play into the part of you, like if you tweak your plans or you change plans or anything during open enrollment from October till December 7th.
Okay,
Yes.
and let's go over really quick, Catherine, the difference between Medicare re-enrollment time and enrolling in Medicare.
So re-enrollment occurs every year at the end of the year from that October to December date. And it's your opportunity to change your coverage, your supplemental coverage and your drug coverage without a penalty. It's the one time a year, unless you have a qualifying event that you can do that. That is different from your original enrollment. With your original enrollment, you must do that at 65, as we were talking about a few minutes ago, or face a penalty.
Okay, all right, we are going to be taking your questions. I'm seeing a whole bunch of them already on my phone. Make sure you get your question in. Let's get the right answer for you. We'll be back in just a few minutes.